Our next speaker is JoAnn Wells. She is the HRSA Perinatal and Infant Oral Health Quality Improvement Expansion Grant Consultant in the Dental Health Program at the Virginia Department of Health, Division of Prevention Health Promotion. She'll be sharing this quality improvement program and also touching on how Virginia has expanded Medicaid dental coverage during pregnancy. JoAnn?
Thank you. Hello, everyone. My name is JoAnn Wells, and I am the Perinatal and Infant Oral Health Consultant for the Virginia Department of Health. Virginia's oral health program has been in existence since 1921, and following national trends in recent years, programs have transitioned away from clinical and restorative care toward broad population-based preventive care. The Perinatal and Infant Oral Health Program at VDH involves work with internal and external partners to improve oral health for pregnant women and infants. This is important because women and their healthcare providers, including dentists, need to know more about the safety of dental treatment during pregnancy and about the growing evidence that the lack of oral health care during pregnancy can have a negative outcome for both mothers and their newborns. It's essential that we increase current and future interprofessional oral health workforce capacity and establish the necessary partnerships to advance integration of oral health into clinical practices through education. Why is oral health for pregnant women and infants becoming a focus for the Virginia Department of Health? This is a critical time for us to address perinatal oral health because in 2012, as you've already heard, there was the release of the Oral Health Care During Pregnancy and National Consensus Statement, and HRSA launched the Perinatal and Infant Oral Health Quality Improvement, or the POQI initiative, as a pilot grant program. In 2013, HRSA expanded the POQI grant funding, and in 2015, the Virginia Oral Health Coalition began providing interprofessional trainings with medical and dental providers. And in 2015, as part of Governor McAuliffe's A Healthy Virginia program, the Smiles for Children dental program began to provide coverage for dental services to pregnant women. The Smiles for Children benefit went into effect on March 1st, 2015, and this coverage was extended to pregnant women aged 21 and over who are enrolled in Medicaid and Famous Moms. A comprehensive list of services, including diagnostic, preventive, restorative, and operative procedures, is covered. Important to note that the dental benefit extends through the month of the 60th day after the baby's birth. So, with federal guidance, funding for perinatal and infant oral health initiatives, statewide collaborative interests through the State Oral Health Coalition, and comprehensive Medicaid dental benefits for pregnant women, VDH set out to expand on activities to improve oral health for pregnant women and infants. Before discussing our current activities, I would like to first tell you about Virginia's Title V MCH history that continues to help shape the future of perinatal and infant oral health in Virginia. Previously, the dental health program was primarily Title V funded, but changes in priorities for Title V funding were noted and funds were redirected. At the time federal funding for oral health became available, and VDH was awarded several grants, including the State Oral Health Collaborative Systems Grant, Targeted Oral Health Surveillance System Grant, and the Oral Health Workforce Grant, and the state-based Oral Disease Prevention Grant, and state general funds were also allocated for preventive service programs. A key feature of the State Oral Health Collaborative Systems Grant project was the development and implementation of the Bright Smiles for Babies, the BSB program, and it incorporated oral health assessments, fluoride varnish application for high-risk infants and young children, and parental education. The Targeted Oral Health Surveillance Systems grant also established a program to improve access to oral health services for children with special health care needs. Although MCH National Performance Measure 13 was not selected in Virginia, Title V funds continue to support oral health programs regarding children with special health care needs, and early childhood health remains a priority in Virginia. The dental health program continues to collaborate with Title V programs on projects and opportunities to expand upon current oral health initiatives and explore new initiatives that have emerged. We continue to partner with Title V staff on multiple projects, including Text for Baby, home visiting, resource mothers, and oral health for individuals with special health care needs. A recent collaboration with the Text for Baby program will allow the dental health program to send customized oral health messages with Virginia-based resources to pregnant and postpartum women across the Commonwealth. The ability to customize messages will enable us to direct women to local numbers and websites for information and services instead of national resources. Messages are sent in both English and Spanish and are timed to be sent at different intervals during pregnancy through the baby's first birthday. VDH will also develop and disseminate a special oral health message to be sent in February, which is Dental Health Month. In addition to working with the Dental Health Program on messaging, the Virginia Maternal and Child Health Coordinator recently provided training on Text for Baby to our POCI grant colleagues in Maine. Oral health is an integral part of preventive health care for pregnant women and their newborns. Many health professionals are aware of the importance of oral health, but often do not address it as part of their wellness plan during preconception and prenatal stages for women of childbearing age, during pregnancy, or during the baby's first year. To address this, since 2005, VDH has implemented the Bright Smiles for Babies Fluoride Varnish program to reduce the risk of childhood caries, increase awareness of the importance of integrated care for medical and early child providers, educate parents on the importance of the primary dentition, daily oral hygiene, and the dental home, and improve access to preventive dental services in non-dental settings. This program utilizes hand-on and didactic training on oral health and hygiene and the application of fluoride varnish for healthcare providers, including pediatricians, physician's assistants, registered nurses, and licensed practical nurses. Additionally, in-depth online training for nurses on implementing the Bright Smiles for Babies program in the local health department setting has been developed, and it's available on the Commonwealth Train portal. The Virginia Department of Health leadership has encouraged implementation of this program statewide. VDH staff provide oral health services in WIC and Well Child clinics. Services begin with a risk assessment for infants and young children who have yet to establish a dental home to help anticipate and prevent dental disease before it starts. Services are provided using the knee-to-knee position as seen in the pictures. Fluoride varnish application is a billable service for dental and medical providers. In addition to screening and the application of fluoride varnish, oral health education and dental home referrals are key components of this program. In fiscal year 16 alone, 6,692 fluoride varnish applications were provided by the dental health program staff in non-dental settings such as WIC, Head Start, and Care Connections for Children's Clinics. Additionally, the number of medical providers trained to apply fluoride varnish continues to increase substantially. Virginia's individuals with special health care needs oral health program began as part of the Bright Smiles for Babies program, but with the focus on oral health for children with special health care needs. This program is now a distinct program for all ages of individuals with special health care needs and provides education to a variety of stakeholders and dental professionals statewide. The goal is to provide better access to care by increasing awareness of how to treat individuals with special health care needs and therefore increasing provider comfort levels in this area. Since 2011, 642 dental professionals have attended the Virginia Department of Health oral health courses related to individuals with special health care needs and early childhood. 1,743 health professionals, lay professionals, and other individuals have received oral health education regarding individuals with special health care needs, pregnancy and early childhood, and over 2,000 individuals with special health care needs have received preventive oral health services at Care Connection for children, medical specialty clinics, and other disability-related resource events. It is essential that we increase both current and future interprofessional oral health workforce capacity to integrate oral health into clinical practices. New perinatal oral health initiatives aim to educate maternal clients regarding oral health during pregnancy and about the importance of the age 1 dental visit for babies, and to encourage providers to refer women for professional dental care to follow up on their care and to encourage establishing a dental home by age 1. After a successful pilot period of 3 years, the Virginia General Assembly passed a bill in 2012 to revise the practice of dental hygiene for those dental hygienists employed by the Virginia Department of Health to practice under remote supervision, and allowed the Virginia Department of Health to have a concentrated focus on preventive programs. The Virginia Department of Health Dental Health Program currently staffs remote supervision dental hygienists in 13 of the 35 health districts. Although pregnant women are occasionally seen in the Bright Smiles for Babies program in our WIC clinics, there has not been a concerted focus on this population. As such, with our POCI grant, we will expand the remote supervision dental hygienist roles and strengthen services to pregnant women, providing care coordination of services, data collection for WIC, enrolled pregnant women, and the infant population. This model will establish the effectiveness of having public health staff involved in an active role in care coordination in addition to clinical services. The remote supervision dental hygienist activities in WIC involve screening and referrals, implementation of the Bright Smiles for Babies, and the individuals with special health care needs programs to include provider trainings and the promotion of oral health resources. VDH needed to obtain baseline data for the POCI grant to assess the oral health status of pregnant women enrolled in WIC. That was the catalyst for the 2016 Basic Screening Survey of Pregnant Women. To collect specific oral health indices and information, the Basic Screening Survey criteria from the Association of State and Territorial Dental Directors was utilized. The ASTDD also provided epi-technical assistance. The dental health program is conducting oral health screenings and surveys of approximately 600 pregnant women ages 18 and older enrolled in the WIC program. The statewide sample includes 20 WIC clinics throughout the Commonwealth with a target of at least 30 women per site. The survey will reflect statewide representation but not produce regional or district level estimates. The screening is being conducted by the Virginia Department of Health dental hygienist, uses national guidelines, and takes approximately 5 minutes. Completion of the survey is anticipated in the fall, and results will be used for policy and program planning to address disparities in access to dental care and oral health outcomes for pregnant women. The basic screening survey is composed of 2 components, a questionnaire and a clinical open mouth assessment. The questionnaire is to be completed by the participants, is based on other national data sets, including the Pregnancy Risk Assessment Monitoring System, PRAMS, and the Behavioral Risk Factor Surveillance System, BRFSS. The clinical survey is performed by dental hygienists and assesses caries, periodontal disease, and the urgency of care. All participating women receive free oral health or oral hygiene supplies for themselves and their new infant, and information on the Medicaid dental benefit for pregnant women, referral information, and follow-up from dental staff. It's imperative that the Virginia Department of Health establish baseline data regarding oral health status and access improved services and document our progress that impacts this population. This slide contains oral health resources for Virginia. The Virginia Oral Health Coalition website has a useful integration toolkit for health professionals that would be helpful to anyone considering medical and dental integration projects. And this is my contact information. Feel free to contact me regarding any information that is contained in this webinar. Thank you for the opportunity to share Virginia's perinatal and infant oral health activities with you today.